Take it away, Dave.
Jeanne, yeah, we had a really good meeting at Nashville, and there was a lot of interest, I think, for our essential oils and our protocols. So it was good to see several new people come on board, and we're pretty excited about that. And I think they were all pretty excited with the information that we shared about what we've been doing so far over the last couple of years with the protocols and with the oils and where we're heading in the future. So all in all, I thought it was a good meeting and exciting to meet new people. A couple, tonight's agenda, I think I just wanted to cover some questions that we received and maybe share our thoughts on the answers to those questions. And then since Lawrence is on as well, maybe can share some of his information and using the protocols. And because there's always a couple different ways of looking at these things and figuring out what's best for your herd. So it's going to be kind of a open-ended, informal type of discussion this evening. And the first topic was someone asked us when to start using the parasite protocol. And they were questioning how many eggs per gram do you need to see, or what do you need to see in order to start a parasite protocol using our essential oils protocol from our booklet? And I guess my answer to that is, it kind of depends on a couple things. First is you want to do a fecal exam and certainly see what your results are for your fecals. And I guess the question there is knowing what you feel comfortable with and maybe what your personal veterinarian feels comfortable with. And when I say that, I mean some veterinarians might see an egg count of 400 or 500 and they want eggs per gram and they want to start treating right away. Some vets might see an egg count of 1,500 or more, and they don't feel like it's necessary to start treating right away. So I think there's a comfort zone there where you feel comfortable at the eggs per gram, but you also have to overlay that on the condition of your animal and what you're seeing with your animal, and the kind of eggs that you're seeing. So if the eggs are something like the barber's pole or the Homunculus contortus, or if you're seeing EMAC, which might be, those two might be a little more severe, then you might want to start treating a little earlier, regardless of whether you have a high egg count per gram or not. On the other hand, if you also want to look at your animal, are you seeing other symptoms with this animal? Do they have diarrhea or runny stool? Do they have a loss of appetite? Are they losing weight? Is their body score, starting to change? Are you seeing lethargy in your animal where they're just not, feeling like having the energy that they normally have? So I think that putting the picture together, it's kind of a puzzle, I guess, and you've got to put all the pieces together in order to figure out when you would treat. And I guess I would base it on when would you treat if you didn't have the essential oils and you were using the synthetics that we've been using in the past, when would you treat your animal? The vets that I've talked to, most of them look at somewhere between, maybe 500 or 600 and 1,000 or so before they thought they would treat, depending on what they were seeing. And in areas like Lawrence out in Texas, in Houston, they have a wet environment. Their vets might be a little more lenient on that in the egg count. Lawrence, I don't want to put you on the spot, but do you have any, what kind of things do you look at before you decide to start using the protocol? And what would your egg count specifically?
But before we started using the oils, the parasitologist at Texas A&M was so concerned about the lack of efficiency or the fact that it didn't work on any of the wormers that we were using, that he said unless there was an egg count of 2,000 or more, he would not treat them. 2,000 is really a high threshold, and that's way above what he normally said, but he's very concerned about the chemical warmers and the fact that the more we give them, the more resistant the parasites are going to be. He did have a disclaimer there, and you mentioned it, Dave. If the animal is showing any clinical signs such as weight loss, diarrhea, lethargy, pale membranes in their eyes, whatever, he said, excuse me, he said no matter what the count is, he would treat those animals.
Okay.
So that's really what we've been going by here.
Okay. And we've been following a similar train of thought here as well, Lawrence. And you just got to look at all the pieces of the puzzle and try to figure out, is this animal getting worse or getting better on their own? Do they need the extra support? Keeping in mind that, you know, as your herd gets healthier and healthier by using the oils, hopefully we're building the immune system as well. And maybe, you know, in the future, your animals are going to be able to handle a higher load. But I would certainly look at all the pieces of the puzzle there and kind of make sure that you're seeing the whole comprehensive picture and then start worming. So I don't know, some of the new people that are on board, Debbie or Lisa, or do you guys have any questions about that before we move on to another topic? I mean, anything in specific that you might be thinking about or have questions for us regarding when to start?
No, not really.
Okay.
Need to get some fecals done here pretty soon to see where I'm at.
Okay.
And for me, I'm focusing on skin issues right now, and then I'll move into the fecals. So.
Okay. All right.
Yeah, I've had some skin issues myself, just with one.
Okay.
But I started using the Munge. I did the spray because she's not a real friendly girl.
Uh-huh.
It is helping. It's just, you know, it's just going to take a little time.
Yeah. Okay. Well, good. We'll talk more about that in a couple of minutes then, and because I would like to get some more feedback about that. But let me go through and a couple other questions that I had that people presented to us. One was about the second question was about doses, and you know, we have in our protocol for parasites and for the immune system, or the post-parasite maintenance dose protocol, the 8 drops of thieves, 4 drops of oregano, 4 drops of paragize. And as you all know, all those oils in oregano on its own, but thieves and paragize, which are blends of multiple oils, all have been researched extensively and have been shown to be effective in their antibacterial, antiviral, antifungal properties, as well as some of the antiparasitic properties. So we started at 8, 4, and 4 because we saw that it worked, and we were trying to balance the cost associated with the effectiveness of the oil. Now, we also know through all of our research that it's almost impossible to overdose on these oils. So you can really boost your ratios up a little bit, or even bring them down a little bit if you feel like you need to do that. But you can go up without concern. But our dose of 844 is a good starting point. Now, and we base that on an average weight adult, so about 150-pound, say, adult alpaca. So if you have a cria that you're thinking about dosing, we would recommend cutting the dose in half for a cria. For a yearling or adult, an animal that's over 100 pounds, I think the dose that we have, the 844, is appropriate dose, and I think it will be fine. Now, and that includes the maintenance dose as well. Now, if you have a severely compromised animal, let's say you have an adult and you're using the 844 dosage on a daily basis per our protocol, and you have a a compromised adult, let's say they have maybe a high parasite load or some other symptoms, or maybe they're a little refractory, to the treatment. They're not responding to the treatment. I think it would be okay based on our research, and Jeannie or Terry, you can jump in here if you have any other comments. So I think it would be okay on our research. You could even double or triple your dosage on an animal like that, until you start seeing some results, till your next fecal exam. Because some of the animals are just more compromised than others. And again, the dosage that we started with our protocol was somewhat on the lower range, or closer to the minimum range than it would be to the maximum range of what you can use for these animals. Jeannie, do you have any comments or follow up on that? Your thoughts?
Well, the oils, I just want to always stress that they're not toxic. You have to, your animal has to ingest a whole lot of them, people also, to get any kind of a reaction to it. And usually the reaction is only because they're not drinking enough water. So people and animals. So because it does draw out, like it's, you're having a die off. So you really want to make sure they're getting enough water when you're, if you've got an animal with a high count, to make sure that they're, expelling them.
No research.
Mm-hmm. So yeah, you can, I mean, as a human, I did a lot of oils when I was recovering from an autoimmune. So, I think I was doing almost 40, 50 drops a day just to work on all my different body systems and get the nourishment that they needed from the oils. Because you have to think they're all plant-based. They all have different constituents, and they all do something that for the body in building it back up. So yeah, that is a real minimal dose that we start with, just because, like you said, Dave, the cost, and then it works. I mean, we don't need to reinvent the wheel. We just need to make it, to where it's, we know it's working. But if you have an animal, that we've had some that they're really close to not making it, and we've had to up the dose, to get that into their system and really attack. But that's all, part of the research we're doing, and the people that are, working with the oils are helping us to understand. So we really appreciate everybody that's on board and helping us understand how we can really prevent is what we're trying to do, but also help those that are in duress.